Have you ever wondered how a pregnancy can end in a miscarriage or preterm birth, even when the mother isn't having obvious contractions? One possible reason is called cervical insufficiency, commonly called cervical incompetence. The cervix is supposed to remain closed and provide support for the pregnancy until the pregnancy reaches term. But what happens when the cervix starts to shorten or soften or opens too early? Let's talk about it. Hello, my name is Chinaza. I am a medical sonographer, and on this space, it is everything ultrasound and women's health education. And in today's video, we will talk about cervical insufficiency or cervical incompetence. Cervical insufficiency is a condition where the cervix begins to shorten, soften, and or open prematurely during pregnancy, often with little or no pain or obvious uterine contractions. And because the cervix is no longer providing adequate support, the pregnancy may be at the risk of second trimester pregnancy loss or spontaneous miscarriage or preterm birth. So yes, cervical incompetence can be one of the causes associated with miscarriage, particularly in the second trimester and preterm birth. Normally, during most of the pregnancy, the cervix remains relatively long and closed. As the pregnancy approaches labor, the cervix naturally begins to soften, shorten, dilate, or open. This process is normal when it happens at the appropriate time. The concern is when these changes happens too early. Some women have a higher risk of cervical incompetence, and these risk factors include a previous painless second trimester pregnancy loss, previous spontaneous preterm birth associated with cervical shortening or dilation, previous procedures involving the cervix, cervical trauma, certain congenital abnormalities of the uterus or cervix. However, cervical incompetence can also occur in women without an obvious risk factor. This is where ultrasound becomes particularly useful. The cervix can be assessed using ultrasound, and when an accurate cervical length assessment is needed, a transvaginal ultrasound or TVS is generally the preferred method. However, a transabdominal pelvic scan can also be used. During the examination, the sonographer obtains a sagittal view of the cervix and measures the functional cervical length from the internal os to the external os. The measurement is usually taken along the closed portion of the cervix. Also, you may hear the term cervical funneling during an ultrasound. Funneling occurs when the membranes begins to protrude into the cervical opening of the cervix as the internal os starts to open, while part of the cervical canal still remains closed. It can appear as V-shaped or U-shaped at the internal os. So what is a short cervix? Cervical length naturally changes during pregnancy, so the gestational age matters when talking about the shortness or the length of the cervix. In mid-trimester, a cervical length of 25 mm or less is commonly used as the definition of a short cervix in appropriate clinical settings. So a normal cervical length should be above 25 mm or 2.5 cm. Can a woman have cervical insufficiency or incompetence without symptoms? The answer is yes. Some women may have few or no symptoms before cervical changes occur. Others may experience symptoms such as pelvic pressure, increased vaginal discharge, mild cramping, back pain, spotting, but these symptoms are not specific to cervical insufficiency or incompetence alone. So as a pregnant woman, you shouldn't wait for symptoms before seeking medical attention, especially if you have been identified as being at the risk of cervical incompetence or insufficiency. Ultrasound can help to detect important cervical changes such as cervical shortening, opening of the internal os, and cervical funneling. However, ultrasound alone does not diagnose every case of cervical insufficiency. The ultrasound findings has to be interpreted alongside the woman's history and clinical assessment. So how is cervical incompetence or cervical insufficiency managed? Management depends on several factors, including how many weeks the pregnancy is, how short the cervix is, whether the cervix is already dilated, previous pregnancy symptoms, whether she has symptoms, and other pregnancy-related factors. And then, depending on the situation, management may include vaginal progesterone, cervical cerclage, increased monitoring, and other measures recommended by your doctor. What is a cervical cerclage? A cervical cerclage is a procedure where a stitch is placed around the cervix to help keep it closed. There are different situations in which a cerclage may be considered. These include history-indicated cerclage based mainly on a woman's previous medical history or pregnancy history. We also have ultrasound indicated cerclage. This is considered when cervical shortening is detected on ultrasound. We also have exam indicated or medical emergency cerclage. This is considered when the cervix has already started to dilate in the absence of active labor, depending on the circumstances. In conclusion, cervical insufficiency or cervical incompetence can contribute to second trimester pregnancy loss and spontaneous preterm birth, but it is important not to assume that every miscarriage or preterm birth is caused by the cervix. There are many other possible causes. And that's that on cervical insufficiency, or what many people still call cervical incompetence. It is one of the conditions that shows why ultrasound is important. During a pregnancy scan, we also look at the cervix that helps to hold the pregnancy in place. If you have any more question or confusion or experience you would like to share, feel free to drop it in the comment section. And if you found this video helpful, don't forget to like, share, and follow for more simple ultrasound explanations and women's health education. And I'll see you in my next one.